Hello and welcome. Today, we'll be discussing a heart condition called constrictive pericarditis. This is a chronic condition where the sac surrounding the heart, known as the pericardium, becomes thickened and scarred, restricting the heart's ability to pump blood effectively. So, what causes this thickening and scarring of the pericardium? In many cases, the exact cause remains unknown, which we refer to as idiopathic. However, several factors can contribute to the development of constrictive pericarditis. These include previous viral, bacterial, or fungal infections, particularly those affecting the pericardium. Other potential causes are chest radiation therapy, often used in cancer treatment, prior heart surgery, autoimmune disorders such as lupus or rheumatoid arthritis, kidney failure, and tuberculosis, although less common in developed countries, can still be a significant cause. To understand constrictive pericarditis, we need to look at the pathophysiology. The thickened and scarred pericardium loses its elasticity. As a result, it acts like a rigid shell around the heart, preventing it from expanding normally, especially during diastole. When the heart chambers fill with blood, this impaired filling leads to reduced cardiac output, meaning the heart can't pump enough blood to meet the body's needs. The restricted filling also causes blood to back up into the veins, leading to increased pressure in the venous system and various systemic symptoms. Constrictive pericarditis is a relatively rare condition. Its exact incidence is difficult to determine because many cases may go undiagnosed. It affects individuals of all ages, but it is more commonly diagnosed in adults. While there are no specific demographic groups particularly susceptible, individuals with predisposing conditions, such as those who have undergone chest radiation or have a history of pericardial infections, are at a higher risk. The signs and symptoms of constrictive pericarditis can develop gradually over time. Common symptoms include fatigue and weakness due to reduced cardiac output. Shortness of breath, especially with exertion or when lying flat, is also frequent. Swelling in the abdomen, legs, and ankles, known as edema, is a hallmark sign of the condition due to increased venous pressure. Some individuals may experience chest pain, although this is less common than in other heart conditions. Other symptoms include abdominal discomfort, ascites of fluid build up in the abdominal cavity, and palpitation. Diagnosing constrictive pericarditis involves a combination of medical history, physical examination, and diagnostic testing. During a physical exam, doctors may detect specific signs like a pericardial knock, which is an abnormal heart sound. Diagnostic tests typically include an echocardiogram, which uses ultrasound to visualize the heart and assess its function. It looks for features such as impaired ventricular filling. Chest X-rays can reveal thickening or calcification of the pericardium. Cardiac CT or MRI scans provide detailed images of the pericardium and heart, helping to confirm the diagnosis and rule out other conditions. Cardiac catheterization is an invasive procedure that measures pressures in the heart chambers and blood vessels, helping to differentiate constrictive pericarditis from other heart conditions. A thorough history and physical, along with the appropriate testing, helps to lead to a diagnosis. While we don't classify constrictive pericarditis into distinct types, we differentiate by the degree of constriction. The severity of the constriction can vary, impacting the presentation and management strategies. Some cases may be relatively mild, while others are more severe, significantly limiting heart function. The primary treatment for constrictive pericarditis is surgical removal of the thickened pericardium, a procedure called a pericardiectomy. This surgery aims to relieve the constriction and allow the heart to function normally. Medical management focuses on managing symptoms. Diuretics are used to reduce fluid retention and edema. Sodium restriction is often recommended to help control fluid buildup. In some cases, medications to manage underlying conditions, such as infections or autoimmune disorders, may be necessary. For patients who are not surgical candidates, medical management may be the only option. Unfortunately, there's no guaranteed way to completely prevent constrictive pericarditis, especially in idiopathic cases. However, several measures can reduce the risk. Prompt treatment of pericardial infections, whether viral, bacterial, or fungal, is crucial. Avoiding unnecessary chest radiation therapy can also help. Management of underlying autoimmune disorders may decrease the likelihood of developing constrictive pericarditis. The prognosis for individuals with constrictive pericarditis depends on several factors, including the severity of the condition, the overall health of the patient, and the success of treatment. Pericardiectomy can be highly effective in relieving symptoms and improving heart function, leading to a significantly improved quality of life and long-term survival. However, the surgery carries risks, and some patients may not be suitable candidates. Recent research has focused on improving diagnostic techniques, refining surgical approaches, and identifying potential targets for medical therapies. Further studies are needed to better understand the causes of constrictive pericarditis and develop more effective prevention and treatment strategies.